Hello, Namaskar. I am Dr. Priya Bhatnagar, your friend, psychologist, academician. Today, back with you again on aspects of discovery of self and body. Yes, friends. So today I am going to talk, state, share a very, very important aspect of our own self and body, which is now almost emerging as an epidemic amongst our teens, and that is body image disturbance. हाँ फ्रेंड्स, जैसे ही मैं ये टर्म यूज़ कर रही हूँ, आई एम श्योर some of you may just not be feeling familiar with the term, and I'm also sure that there must be some of you who must be feeling very close to the concern, right? Friends, what is body image disturbance? ये क्या है और इससे हमारे बच्चे मिलेनियल्स क्यों इतना इम्पैक्ट हो रहे हैं? Let me state it for you, friends. Body image disturbance is a kind of a discrepancy that you have in your real body size and the way you perceive your body size. आपकी बॉडी में एक्चुअल डायमेंशंस क्या हैं और आप उन डायमेंशंस को क्या परसीव करते हैं, उसके बीच का जो डिफरेंस है, दैट इज बॉडी इमेज कंसर्न. सो लेट अस से दैट इफ एन इंडिविजुअल हैज अ वेस्ट साइज ऑफ 30 बट परसीव्स इट टू बी 34, जब वो अपने आप को देखता है तो उसको वो इमेज 34 के रूप में नज़र आती है. जब वो अपने आप को मिरर में देखता है या देखती है तो उसको अपना बॉडी साइज एंड शेप ओवर इवैल्यूएटेड लगता है. एंड व्हेन दिस ओवर इवैल्यूएशन स्टार्ट्स coloring your mind, coloring your mood, impacting you deeply, emotionally and cognitively, that is where, my dear friends, the problem begins. It is very unusual to hear this. I totally agree. But, friends, it is very common to see. And it comes up in very, very minute gross behaviors like body checking. तो आपने कभी कुछ अपने दोस्त ऐसे देखे होंगे, some friends of you who constantly check their body, who have over concerns about their body, and who would always ask you, am I looking nice today? Do you think this is fitting me well? They look for validations. At times, they are very, very fearful of their own bodies and they engage in something called body avoidance, which means that they would not want to be evaluated by others when it comes to body. और उसके simple behavior क्या होता है? Not wanting to get weight check done in front of others, not wanting to be measured in front of others, not wanting to show the body, or maybe something like not going to a trying room. That's body avoidance. It also comes in a way where you happen to have a lot of fat perception around your body. So when you try and see a lot of fat around your body where actually does not exist, that is where it is entering into an area of body image disturbance and an area of concern. Many times people who suffer with body image disturbance, they engage into an aspect of body comparison. They compare their bodies very strongly with bodies of other people. And who are these other people? At times it could be their own peer group, friends. At times it is also the social media. It is also the celebrity zero size figure, so on and so forth. The list is not exhaustive. At times they also get into a lot of body display. So where on one side you have body avoidance, on the other side with some people it could also be body display, where they want to show the actual size of the body by wearing over-fitted clothes, by wearing something which tries to make them believe upon to the actual size of the body. But very sadly, friends, they are not able to believe on their own judgments. They look very strongly for validations outside. Body checking, body avoidance, body comparison, and body display. These four things come as a very, very strong behavioral dimension, behavioral symptoms of body image disturbance. Friends, let me also tell you, this sound to be, little common, where you might feel, अरे ये तो कुछ कभी कभी मैं भी करती हूँ. In front of the mirror, I spend a lot of time trying to check how do I fit into something. Yes, that's true. Most of us do it. You do it, I also do it. But then, friends, we need to understand the line where it becomes pathological. And what is that point? What is that aspect, that hit point, that epicenter where it turns pathological, where it needs to be corrected, where it needs to be looked into? The point is where you start evaluating yourself in just two terms: weight and shape. So you are with a high self-esteem if your weight is less and if you are in a perfect shape. And if anybody happens to comment very simply onto you saying, it seems that you've gained weight, such kind of a comment could be an absolute catastrophe for you, and it may just bring down the self-esteem. ये वो स्पेस है दोस्तों जहां पर हम अपने आप को सिर्फ दो चीजों में इवैल्यूएट कर रहे हैं: मेरा वेट और मेरी शेप. इसके अलावा आपकी कोई भी और एस्पेक्ट, आपकी बाकी अचीवमेंट्स, आपका लाइफ, आपके लाइफ के लोगों का आपकी तरफ नजरिया, हाउ मच यू आर लाइक्ड एंड लव्ड बाय अदर्स, और योर achievements in many other spaces might just go under acknowledged. I am acceptable if I'm thin. This is the core belief that people with body image disturbance go ahead with. They live on this belief. I am liked more if I am in a perfect shape. I am loved more if I have the right weight. This is the space where we need to look into the depth, where we need to check it. Also, friends, body image disturbance is a very strong factor which not only revolves around your body, but it captures your mind, it captures your heart, and it is all around your behavior. Basically, then, the way you think about your body, the way you feel about your body, and the way you behave with your body, you relate with your body, that is body image concern. There are also some related other aspects of body image concern. Sometimes there are synonymous concepts which come up. At times they are interchangeably used, but they are not the same. Like body image dissatisfaction. Now, body image dissatisfaction is another aspect. It's not same as body image disturbance. However, some people happen to use it interchangeably, but it isn't correct. Body image dissatisfaction is at, I must say, in a laymanish language, it is at a little lesser gravity than body image disturbance, and it relates with dissatisfaction towards different parts of the body. So like some people might tell you that, I wish if I would have less fat on my face, or I wish if my arms would have been less heavy, or if I would have had less fat onto my belly. So they are expressing a concern towards a specific part of the body. They're not satisfied with that specific aspect of the body. However, by and large, they are able to see themselves beyond that dissatisfaction also. They are not evaluating themselves in terms of positive and negative only because of that part of the body. And thus, it may not be very pathological, and it may be a very general concern or a comment or a wish towards your own body. However, friends, body image distortion, very close to disturbance, at times they are almost interchangeable, is where you perceive your body size over than your actual size. This is a very difficult space, friends, to be in. And let me tell you, friends, this is almost, like I said before, an emerging epidemic with our younger ones specifically. The aspect of body image disturbance is also very core to the idea of another pathological concern, another psychiatric disorder, eating disorders. That's another dimension, friends. Of course, again you would be feeling, eating disorders? ऐसा भी कुछ होता है? खाने से disorder? But yes, it is. So when you evaluate yourself absolutely in terms of weight and shape, and you try and fit into that ideal size of weight, what are you going to do? Very bright chances you are going to withdraw from food, you are going to over-exercise yourself to fit into that ideal weight. And that is where you enter into the space of dysfunctional eating attitudes and dysfunctional beliefs about self, furthered into eating disorders like anorexia nervosa, bulimia nervosa, or maybe binge eating. In trying to understand how does body image disturbance develop, briefly, friends, I'm going to state it comes very strongly from the media. There are immense evidential support to this fact. Media portrayal of the ideal figure lies at the core as a cause of body image disturbance. So when media shows zero size as something extremely wanted, as something to be perfect, of course all of us seek those perfections then. We challenge ourselves also, whether it is zero size in females or it is an 8-pack app in males. Many of us try and approximate. Many of us, even if we can't approximate, we wish, I wish if I would have had that. And that is where the seed is sown, the seed of dissatisfaction is sown, which might further into disturbance. How you have been treated in your childhood, in your past, that also has a very strong impact on how you relate yourself with body. A very common phenomena at times, a very, very common, we don't even acknowledge it as something. So if somebody in childhood, if you would remember a group of friends, if somebody is little plump, mota or moti is the common word associated. And that child is labeled with that term, is associated with that term, is called with that term. And the child internalizes one's own self, associates one's own self with that term. How difficult it is. The child grows with that term. And when the child grows, child makes it a point that I am no more going to be a mota or a moti. I am going to work upon this. I am going to make it sure that this does not stay with me as a feeling. And that is where you may try to be very harsh upon your own self and upon the body. When it comes to trying to seek treatment to body image disturbance, let me tell you friends here, we first need to understand what it is and acknowledge, evaluate ourselves. हमें देखना पड़ेगा क्या मेरा कंसर्न नॉर्मल है या ओवर कंसर्न है. हम सबको अपनी बॉडी से कंसर्न होते हैं, but some of them are normal and some of them are too heavy on us. They occupy our mind. I'm not able to concentrate on anything because my entire focus lies onto my body. I'm not able to feel anything because my entire space lies onto my body. So if I'm complimented, then I'm happiest. And if I'm commented, snide, then I have a bad day. I go emotionally on a roller coaster ride. So one has to understand, friends, that when it comes to treatment, the first thing is we have to educate ourselves with the concern. And that is why I am here today. Also, it requires professional help. बहुत लोग बोलते हैं अरे बॉडी के बारे में बस ज़्यादा सोचती है और कुछ नहीं है, इसको पतला होना है बस. It is not just these two trivialized statements. बॉडी के बारे में सोचती है, बॉडी के बारे में ही महसूस करती है और वो अपनी बॉडी को पसंद नहीं करती है. There is a dimension of body negative. You do not like your body. You do not appreciate your body. And thus, you do not like and appreciate your own self. आप अपने आप को पसंद नहीं करते हैं. आप अपने आप को तब पसंद करते हैं जब बाकी लोग आपको पसंद करना स्टार्ट करते हैं या जब आप उस वेट रेंज या शेप रेंज में आते हैं. और ये कौन डिसाइड करेगा कि क्या परफेक्ट बॉडी साइज और बॉडी शेप है? हो सकता है किसी के लिए 0 साइज बहुत अच्छा हो सकता है किसी के लिए थोड़ा सा कम भी ठीक हो. दिस इज अ वेरी वेरी subjective dimension, friends. It varies from person to person. Definition of ideal body varies from person to person. There is no standardized definition that is going to tell you this is the perfect size and this is the perfect body. And that is where media makes it even worse in ill-defining it for ourselves. So when it comes to looking into it, we have to understand that there are therapies that are completely devoted or specific in dealing with body image disturbance. Cognitive behavioral intervention might really work well here. But you'll have to seek help of a professional. Before you seek help, you have to understand that it requires that worth to be looked into. ये कंसर्न है. और जब आपका बच्चा बार बार आपसे पूछे मैं अच्छी लग रही हूं और वो फिर भी ना बिलीव करे, वो 4 लोगों से बाहर जाकर और एविडेंस गैदर करे, आपको वहां पर अलर्ट हो जाना चाहिए. दैट इज द पॉइंट वेयर यू हैव टू bring it into your mind that this may not be very normal. Friends, it is a very, very grave concern. It does not only relate to your body, it relates to your mind very strongly. This concept of body image disturbances is never, it was never known to Indians. But now it is a well-known concern. हम हमेशा सोचते तो वेस्ट में होता है, नहीं, पर आज नहीं वेस्ट में होता. आज का टीनेज ग्रुप इससे सबसे ज्यादा अफेक्टेड है. सोशल मीडिया, use of social media, misuse, abuse of social media is a very important contributory factor. So let us, friends, try and understand that we have to accept the body as it is. Yes, of course, I may not be very okay with certain aspects of my body, maybe the weight, I think I'm overweight, or maybe I need to work upon my shape. That's another part that can be worked upon in the right way. But when I start relating myself negatively only because of that weight and shape, and I forget all other aspects of my existence, all other ingredients that compose me, that is where I am entering into a pathological space. That is where it is no more okay. And friends, it is also okay not to be okay. Just acknowledge this fact inside you. It's okay not to be okay. अगर मैं कुछ ऐसा फील कर रही हूं तो मैंने उसको एक्नॉलेज किया है. एंड इट्स ओके इफ आई एम फीलिंग लाइक दिस कैन बी वर्कड अपॉन. बट अपनी फीलिंग को डिनाई कर देना और उससे अंदर ही अंदर परेशान होते रहना, वो कभी सोल्यूशन हमारे लिए नहीं लेकर आ पाएगा. सो with this, friends, I would wish to tell you that let us be more body positive, let us be more acceptable towards our own body, and let us nurture and love ourselves. With this, friends, I say a goodbye to you, and I wish that all of us start with the aspect of body positive, and we start loving ourselves, accepting ourselves unconditionally, and also loving and accepting others unconditionally. With this, I say a bye, a goodbye, and I wish that we are all into a good space of body, mind, and soul. Thank you, friends, for this patient hearing. Bye. Namaskar.